Plaintiff case number 4. Dentist revises process to safeguard medical alert PHI. HCA 322. Healthcare Ethics and Medical Law. Professor Joyce Williams, March the 12th, 2018. Esteemed ladies and gentlemen of the jury, I come before you today to explain how the AU Bright Smiles Dental Clinic victimized me and several other patients. So I'm here to tell my story. My name is Robin Awal. I am a wife, a mother, and a community leader. During the birth of my son, I lost an enormous amount of blood and I required a blood transfusion. It was during this transfusion that I acquired the human immunodeficiency virus, commonly known as HIV. This virus can annihilate your T cells. These cells control your immune system. By doing so, your body becomes unable to fight off deadly infections like cancer, and before you know it, you're living with full-blown acquired immune deficiency syndrome, or AIDS. I have lived quietly with AIDS, and only my healthcare providers, the CDC, and my family were aware of my condition. That was up until the AU Bright Smiles Clinic did the unconscionable. They flagged my medical records with a sticker, and on that sticker it stated AIDS. It was written on the outside of my medical record for any and all to see. This is not just an allegation. This was confirmed by the Office of Civil Rights, the OCR, after an in-depth investigation. This is wrong on multiple levels. First, I'm like every one of you. I believe that my private health information should be just that, private. Our federal government believes the same thing. Thus, the enactment of the Health Insurance Portability and Accountability Act of 1996, referred to as HIPAA. The law specifically states that my health insurance is private and that it should be protected. HIPAA identifies what constitutes protected health information. This includes, but is not limited to, the person's physical, mental, and/or health condition, whether it is existing or from a past diagnosis. HIPAA goes on to explain who must adhere to the privacy rule. Healthcare providers are among that list, just like the AU clinic. So, as I stand before you today, I am certain, based upon the Health Insurance Portability and Accountability Act of 1996, that the AU Bright Smiles Clinic has violated my HIPAA privacy rule. Yeah, the OCR is mandated that the AU clinic revise their process to safeguard medical alert protected health information to avoid future compliance issues. However, a similar case such as mine awarded a $100,000 settlement because of failure to comply with HIPAA. In this similar case, the practice did post medical record information online. That's the only difference. Mine was on a folder for everyone to see, just like this practice that was online. So, privacy refers to a person's expectation to keep control of his or her private information. I lost control of mine when the AU clinic put that sticker on my file. Second, there are state laws that specifically protect HIV-related information. All 50 states require that physicians and labs, like I said before, report this to the CDC if a patient's diagnosed with HIV and/or AIDS. And I'm aware that my health information is out there, but it's not my identity. It's just a number, a code. The American College of Healthcare Executives, and I quote, believes in addition to following applicable state laws and HIPAA that healthcare providers have a moral and professional obligation to respect confidentiality and protect the security of all patients' medical record information. The AU Bright Smiles Clinic violated not only my legal rights, but failed to conduct business in an ethical manner. The American Health Information Management Association authored a list of guidelines for individuals who handle medical record information. Although all health professionals are not certified as health information managers, these guidelines are a part of the code of ethics that should be adhered to. They are as follows. Number 1, advocate, uphold, and defend a patient's privacy in the use and/or disclosure of private health information. This was certainly not the case at the AU clinic. Flagging my records with my diagnosis was an unethical, careless act. Number 2, preserve, protect, and secure all confidential healthcare information by respecting the nature of that information and maintaining confidentiality. Ladies and gentlemen of the jury, we all know that the AU clinic disrespected my private information by flagging my records for any and all to see. Number 3, declined to be a party of any unethical practices. How is it that not even one person in that clinic recognized that my private information was just that, private? And by sharing this and placing flags on it, that simply was an absolute unethical practice. Number 4, and I quote, respect the inherent dignity and worth of every person. I ask you, ladies and gentlemen, can any of you honestly say that my dignity was respected? Finally, up until the AU clinic shared my diagnosis, I was Robin Awalt, a wife, a mother, and a community leader. Now I am Robin Awalt, the lady with AIDS. Up until my diagnosis was made public, I lived a fairly normal life. Normal without stress. Minimal. Now I'm plagued daily with stress of being identified as that person with that misunderstood disease. This is causing me to face ongoing psychosocial stress. It is because of this stress that I'm experiencing heightened depression, an inability to meet professional obligations and social obligations, and a diminished quality of life. Exhibit B shows my doctor's orders and my doctors substantiating what I've just said. Ladies and gentlemen, I thank the AU Clinic for my decline and my inability to manage what once was a manageable diagnosis. I'm asking you today, for each of you to think back to a time that something private about yourself was made public and the grief and anxiety that accompanied this situation. I'm asking for you to champion me and all others who are in this situation and make the AU Clinic reward me and others with a settlement that's commensurate to the pain and suffering that has been incurred. I thank you all for your time.